In this video, I will explain how to identify benign odontogenic tumors in multiple choice question with some unique points to identify tumor. And after that, I will give some scenarios so that you can clearly understand. First, we have to categorize based on age. In children, mostly primordial odontogenic tumor is seen, but there are only few cases are reported till now. Younger age group, here age less than 20 or 25 years can be categorized as younger people. In this category, adenomatous odontogenic tumor and ameloblastic fibroma are seen. Here adenomatous odontogenic tumor is seen mostly in females and ameloblastic fibroma has slight male predilection. For middle age group, here middle age comprises of second or third decades, mainly cementoblastoma, odontogenic myxoma, pinball tumor are otherwise called as calcifying epithelial odontogenic tumor, then squamous odontogenic tumor. Here the tumors mostly seen in old age are ameloblastic carcinoma. Some tumors can occur in any age. These are ameloblastoma, odontoma, clear cell odontogenic carcinoma. Here I mention tumors which are predominantly seen according to their gender. That is, for males, ameloblastic odontoma, ameloblastic fibroodontoma, ameloblastic fibrosarcoma, and ghost cell odontogenic carcinoma. And for females, adenomatous odontogenic tumor, clear cell odontogenic carcinoma. These tumors are predominantly seen according to their gender. Now coming to location, here for anterior maxilla, the tumor has more predilection adenomatous odontogenic tumors and compound odontoma. Here it is called as compound composite odontoma. Another type is complex composite odontoma, which is seen mostly in posterior mandible. The next is for posterior mandible. Here ameloblastoma, which is seen mostly in ramus area, cementoblastoma, which is seen mostly in molar area, complex odontoma, ameloblastic fibroma, ameloblastic fibrosarcoma, and ameloblastic carcinoma. These are mostly seen in posterior mandibular areas. Based on the unique radiographic appearance, we can categorize the tumors. First one is ameloblastoma, which has mainly soap bubble appearance, seen mostly in multilocular cases. Next one is pinball tumor, or otherwise called as calcifying epithelial odontogenic tumor, which has unique driven snow appearance, which is there is mixed radio-opaque or radiolucencies are seen due to calcification of this tumor. The next one is odontogenic myxoma, which has honeycomb appearance and tennis racket or step ladder appearance. These appearances are due to the arrangement of fine trabeculae. Squamous odontogenic tumor, it has unique semicircular or triangular radiolucencies in between two roots. Adenomatous odontogenic tumor, which is mostly unilocular, rarely multilocular cases are seen. Pain are seen in some of the tumors. They are primary intraosseous carcinoma, cementoblastoma, ameloblastic fibroma. Here the patient has main chief complaint is pain or slight swelling, and ameloblastoma. Ameloblastoma, mostly large lesions exhibits pain and smaller lesions are usually painless. Coming with associated tooth, many tumors that is mostly associated with impacted tooth, some exhibits root resorption, tooth displacement, or some occur in edentulous areas. Here ameloblastoma, root resorption is mostly seen in affected cases. And for odontoma, there may be impaction, aplasia, malformation or malpositioning, and devitalization of adjacent teeth seen. Here I have given some unique histopathological features to identify the tumors. Squamous odontogenic tumor. The name itself indicates that it has squamous epithelium. Yes, it has islands of mature squamous epithelium with or without sclerotic border. Microcyst and also intraepithelial dystrophic calcification is seen. The unique feature of pinbark tumor is amorphous eosinophilic amyloid material, which is seen predominantly in this tumor only. And lysogang rings, these are concentric lamellar calcification, and there is a clear cell variant is found in pinbark tumor, which can be discussed later. And also dystrophic calcification is seen. Adenomatoid odontogenic tumor, it is also called as two-third tumor. Why? Because it has two-third predilection for young female maxilla and also associated with unerupted tooth. In histopathology, it exhibits eosinophilic amorphous material, lysogang rings, and hyaline ring. Hyaline ring duct-like structures, which is seen mostly in this tumor only. Next, granular cell odontogenic tumor. It has abundant coarse eosinophilic granular cytoplasm, as the name indicates. Ameloblastic fibroma. Here it is a mixed tumor and there is no enamel or dentine tissues are seen. It is mostly associated with unerupted tooth. Cementoblastoma. In cementoblastoma, there always a calcified mass is attached to the root and also a cementum-like material with prominent basophilic reversal lines are seen. The most unique feature in sclerosing odontogenic carcinoma is perineural invasion. Clear cell odontogenic carcinoma. Here there is large polygonal cell with the clear cytoplasm, that is mainly clear cells are seen as the name indicates. Next one is PAS positive, that is periodic acid Schiff. Why it is positive is it has abundant intracellular glycogen accumulation and also it is mucicarmine negative. It is a clear cell variant of pinbark tumor. Next, odontogenic myxoma. It has loosely arranged spindle or stellate shaped cells dispersed in myxomatous stroma. It has a mucoid-like material. Ghost cells. Ghost cells are mainly seen in three tumors, that is dentinogenic ghost cell tumor. It can be differentiated from other ghost cells tumor is it has dentinoid material along with the ghost cell, and is ghost cell odontogenic carcinoma, and it also exhibits cellular atypia. And odontoma. Odontoma exhibits ghost cell occasionally. This is the unique feature for each of the benign odontogenic tumor. Remember, you have to study these to identify scenarios. Case scenario 1. Identify the tumor. Answer is pinbark tumor. Why pinbark tumor is? Here mainly duct-like structures, which is a unique feature in pinbark tumor, and lysogang rings, which is seen in two tumors, that is pinbark tumor and adenomatoid odontogenic tumor, but duct-like structures are not seen in adenomatoid odontogenic tumor. And also a striking evidence is it has large areas of amyloid-like material. Amyloid-like material seen mainly in pinbark tumor only, not adenomatoid odontogenic tumor. So the correct answer is pinbark tumor. Next case scenario. Answer is ameloblastic fibroma. Why ameloblastic fibroma is? In this case, it is mentioned as 12-year-old boy, which is adolescent. In adolescence age group, ameloblastic fibroma and adenomatoid odontogenic tumor are mainly seen. But adenomatoid odontogenic tumor has predilection for female and for maxilla, not for mandible. It is mentioned as posterior mandible, and ameloblastic fibroma has predilection for posterior mandible only. In mesenchymal component, there is no evidence of hard tissue formation. It strongly indicates that it is ameloblastic fibroma. In early odontoma, hard tissue formation is not seen and it has resemblance to dental tissues. But here in this case, there is no evidence of hard tissue formation. Next is case scenario 3. Identify the tumor. Answer is odontogenic myxoma. Odontogenic myxoma is mostly seen in middle age group, and also a striking feature is soap bubble or tennis racket appearance. It is seen mainly, that is, tennis racket appearance is seen mainly in odontogenic myxoma. And also a unique feature is there is no odontogenic epithelial rest found within this lesion. So in odontogenic myxoma, there may be few or inactive or no odontogenic epithelial rest seen. Case scenario 4. Identify the tumor. Answer is complex composite odontome. In this case, there is coagulation of enamel, dentin, cementum, pulp tissue. This strongly suggests that it can be a odontome, and also it has no resemblance to tooth shape. That is, it mainly indicates that it is a complex composite odontome. In compound composite odontome, it has main predilection for posterior mandible, and for complex, predilection is anterior maxilla only. And also in compound composite odontome, there is some resemblance to normal tooth structure. This case strongly indicates, and the correct diagnosis is complex composite odontome. Here is the summary.